My name is Presnell. I'm a nurse practitioner at Tanner Clinic in the Endocrinology department. We treat a lot of medical issues in endocrinology, but one of the most common is hypothyroidism or low thyroid function. It's a very common disease. About 5% of our population in the United States have this condition, and many of them don't even know it. Symptoms to watch for would be fatigue, dry skin, constipation, maybe hair loss too. If you have any of those symptoms, it's a simple test. You can see your primary care doctor and have your thyroid levels checked. You don't necessarily need to see an endocrinology department to have this diagnosed or initially treated. It's also related to your autoimmune system, which is a genetic condition. Hypothyroidism often runs in families. So if you have a family member who has hypothyroidism, it's a good idea to be checked if you have any symptoms at all. Also, another symptom is an enlarged thyroid right here at the base of the neck. If you have a large thyroid, have your thyroid levels checked. Kids who have hypothyroidism, you'll often see a large lump at the bottom of the neck. So if you have hypothyroidism yourself, and if any of your children have that, it's worth having it checked as well. There's many different medications we can use to treat hypothyroidism. The best, in my opinion, are levothyroxine and liothyronine. They are pills you take in the morning once a day, and they correct that thyroid dysfunction. They're very simple to take, they're inexpensive. Many times, primary care providers will treat you with levothyroxine, and then if you have continued fatigue, I believe that starting on an additional pill of liothyronine is beneficial. If you have hypothyroidism, having your thyroid levels checked at least once a year is important. I recommend every 3 to 6 months, especially if you're still having some fatigue.